It will be my pleasure now to announce and to welcome our fourth speaker, Dr. Miguel González Andrades, who is the chair of the SOE Young Ophthalmologists and assistant professor at the University of Cordoba. He will discuss the topic of benchmarking and harmonizing ophthalmology training in Europe. Please, Miguel.
I would like to thank to SOE and the webinar organizers the opportunity received to present our work about benchmarking and harmonizing ophthalmology training in Europe. I have no actual or potential conflict of interest in relation to this presentation. Residency programs have been established as the pillar of the medical specialization training. However, despite its importance, there is currently no consensus on the medical and surgical competency that a trainee should acquire during residency in order to obtain certification to practice as an ophthalmologist in the different countries in Europe. This causes enormous variations of training experience among trainees in different countries in the continent. Additionally, there is currently a paucity of information regarding the training content and conditions in the different European countries. Thus, we aim to benchmark ophthalmology residency training in European countries to assess the differences and possible deficiencies and to gauge among the trainees their degree of satisfaction with residency training in order to harmonize and enhance training in ophthalmology across Europe. For that purpose, we conducted a survey using the online platform Google Form between November 2018 and January 2020. We targeted all the European young ophthalmologists who were undertaking residency training and those within 2 years of completing residency training. We asked those in training to respond based on their training experience up to the time of the survey. If the respondents have completed residency training, we asked them to respond according to the overall experience of their residency. For excluding those who submitted incomplete responses, 214 participants were included in the data analysis. These participants represent 36 European countries, all of which offer ophthalmology residency training. The median number of participants per country was 7. The country with the highest number of participants was Portugal with 19, followed by France and Turkey, 18 each. Among the respondents, most of them indicated that they undertake residency training in a public medical system, and at the time of the survey, most of them were residents. The median for the duration in years of ophthalmology training of the survey participant was 4 years. The countries with the longest training were Ireland and the United Kingdom with 7 years. By contrast, Ukraine and Russia 2 years and Belarus 1.5 years were the countries with the shortest training. UEMS have claimed 3 years as a minimum residency time, which may explain the observation that mainly non-European countries with less than 3 years. Among all the respondents, 75% state that they had a national residency curriculum common to all training centers. 20% did not have one, and 5% didn't know if they have one. The importance of following a residency program to acquire the necessary competency should be transmitted to the residents, not only for knowing and expecting what they will do in the residency, but also for them to demand a proper training. The heterogeneity among countries also affects the need of a mandatory examination prior to practicing as an independent ophthalmologist. 55% reported the presence of a mandatory certification process, either in the form of a specific national examination or a national board for ophthalmology, while 20% are not required to sit any mandatory examination prior to practicing as an independent ophthalmologist. Surprisingly, in countries like Belarus, Denmark, Finland, France, Italy, Norway, Spain, Sweden, and Turkey, the remainder are required to sit regional examinations, the EVO or the ICO examinations. Most of participants reported a good level of confidence in the clinical competencies achieved during their training period. The respondents reported the highest confidence in the examination of the visual field confrontation, the measurement of intraocular pressure, and the examination of the fundus of the eye. Conversely, procedures in which respondents felt least confident in were the force reduction test, interpretation of electrophysiology studies, indirect ophthalmoscopy, vascular indentation, and prism cover test. Regarding cataract surgery, based on those who have a minimum surgical number mandated by their training program, the median number of phacoemulsification surgery required for each trainee was 25. The number of phacos performed per resident in each European country is shown in this figure, and focus on those responding in their fourth to seventh year of residency or those who already finished. The median of phacoemulsification surgeries performed were 50 during the residency period, and 47% of them performed less than 25 cases. In this group of more experienced residents, only 2 countries showed a median of more than 300 phacoemulsification surgeries: Portugal and United Kingdom. Most of the respondents, 72%, indicated that they should perform an average minimum of 100 cataract surgeries in order to feel surgically independent. If we consider the fourth year residence as a reference, as it corresponds to the median duration of residency in our study, and therefore should reflect the representative final surgical volume for a given resident in Europe, more than 34% would have graduated without performing a single phacoemulsification surgery, 47% without ever excising a pterygium, and 31% never repaired any eyelid laceration. These values are staggering, especially since these are common procedures considered essential for any ophthalmologist. In this heterogeneous context, the majority of participants, 69%, were in favor of an official program common to all European countries, and most participants agree, 40%, or completely agree, 24%, with the need to complete an exam in order to be eligible to practice as an ophthalmology specialist. It is evident from our data that there is a deficient surgical training, since a considerable proportion of the respondents are far from achieving the minimum standards set by some of the European countries included in this survey. The deficient surgical training is also reflected in the degree of satisfaction of the participants. While most were either completely satisfied, 6%, or very satisfied, 40%, with their medical competencies, as you can see here, only 16% were completely or very satisfied with the acquired surgical competency, and 42% indicated that they were completely unsatisfied with their surgical competencies. In conclusion, this study reflects the great heterogeneity in the different residency training programs and competencies achieved by ophthalmologists in training according to their country of residency, especially in terms of surgical skills. Residency in ophthalmology has vital importance in the abilities to be acquired by the staff during the training period in order to act as an independent ophthalmologist. Thus, it could be essential for national governments as well as governing bodies to establish a European training curriculum common to all national teaching committees. Finally, I would like to thank to my colleagues and friends from the SOIO committee, Simon, Yelena, Marie-Louise, and especially Roberto Anaya, their excellence and perseverance to perform this work. And also, we really appreciate all the help and support in this project from the SOIO committee and the SOE and the national representatives. Thank you so much.
Thank you, Miguel, for pointing out the problems and the differences in the training in ophthalmology and the need to harmonize our training.